As you may have heard, the Medicare annual enrollment deadline is fast approaching, and joining us this morning with what you need to know before it's too late is David Price for UnitedHealthcare Medicare and Retirement in Florida. Good to see you.
Good morning.
So yeah, this is a really important time for people. Talk about annual enrollment. Why is it so important?
Well, first of all, annual enrollment starts on October 15th. It goes through December 7th. It's just like us in our open enrollment periods. They're making decisions that affect their health as well as their wallet. From the Medicare enrollee out there, this may be the only chance that they have to make changes to their coverage. Now, they could be, if they just do nothing and roll it over, they could be locked into a plan that if their health status changes or their budget changes, you know, they could have some unnecessary experiences and miss out on any savings for the upcoming plan year in 2020. So I would advise the Medicare population out there to take their time, do their due diligence, and really try to pick a plan that's going to help them from their health needs as well as their their budget.
Well, and that's what I hear a lot is just don't assume that the plan that you had last year is going to be the same that's going to work for you this next year.
Correct.
So what advice do you have to kind of make this process of choosing the right plan? Because there are several out there. What advice do you have for people watching this morning?
Right, and it can seem overwhelming, complicated, but it doesn't have to be.
Okay.
It doesn't have to be. So we're here to help navigate the process. I would just think about these things. If your current coverage is meeting your needs, just find out if it's going to change for next year.
Okay.
Second, is it meeting your budget needs? And when I say that, don't think about only plan premiums. You have to think about the co-insurance, the copay, the deductibles included. Most importantly, please make certain that your medications are covered under the new plan. Because those change year over year, just like the plan does, and also the expenses involved with those plans change.
Now, this is interesting too, because there's actually plans that you and your team say that you can kind of choose to actually help people stay healthy as well. What do you mean by that? What should people look for?
Correct, and choosing the correct plan can have an impact on your health and well-being. And I think it all starts with access to care, making certain that your primary care physicians that you see, your specialists that you see, and the hospitals that you may or may not go to are included in the network, or included in the coverage that you're going to get for the following year.
Okay.
And don't forget about and benefits such as vision, hearing, dental, prescription drug benefit. Yeah. Those are not included in original Medicare, but they are included in many Medicare Advantage plans. Also, think about taking advantage of the wellness programs that are offered through these plans. Many people don't realize that there are health, fitness programs available through these plans. UnitedHealthcare, for example, has a program called Renew Active. It is a network of gyms and locations to go to get physical fitness, and it also has a personalized, health coach involved in the program. So,
all right. Well, as we kind of close up here, where can people go? As you said, it doesn't have to be a confusing process. How can people get more information?
So, if you want to know more about UnitedHealthcare plans, there is a website, uhcmedicarehealthplans.com.
Okay.
My favorite to go to learn more about Medicare in general is MedicareMadeClear.com.
Okay, easy enough. Thank you so much. Again, we're so happy that there's a team here that's ready. As you said, it doesn't have to be complicated.
That's correct.
Just reach out, ask for help. There is the number to do so. Again, that website that he mentioned, and we, of course, will put it on our website, too, to make it easy for you.